the dreaded department of periodontics.
Perio disease, that's right.
Everybody hates periodontics. Dentists, hygienists, assistants, patients. It's so important that you understand the mechanisms, because if you understand what it is, you'll be far better able to control it. Periodontal disease is a bacterial infection. Think of it like catching a cold. When you catch a cold, you get bacteria in the nasal cavity. Your nose gets stuffy and inflamed. Your body creates mucus. That mucus encapsulates the bacteria. You blow it out, cold goes away. Same process happens in the mouth, except we have biofilms that build up on the teeth, which encompass bacteria which are alive. Those bacteria secrete toxins into the tissues, which then trick the immune system to think that the bacteria is inside the body. The body or immune system can't get to that bacteria, so it turns on itself. The body's very clever. I know what I'm going to do. I am going to get the tooth that's just holding the bacteria out of the mouth. That's right. I love doing that. That's the calcium salt sticking to the teeth with an electromagnetic bond that only your hygienist or dentist can get off. It eats the bone away around the teeth, causing patients to have sensitivity, bad breath. It's funky. You can smell it at least 6 feet away.
Yo, what's that smell? Oh boy, that's your breath.
Destruction is happening 24/7. And it's our job as practitioners to convey this message to our patients. So not only will they understand the disease, they can start to have power and stabilize the disease.
I'll have you smelling like